Atrial fibrillation, abbreviated as A-Fib, is a severe heart condition in which the heart goes through an irregular, chaotic and rapid heartbeat. An irregular rapid heartbeat is also known as arrhythmia. Atrial fibrillation is dangerous and may be life-threatening, as it leads to blood clots in the heart, and then stroke and heart failure. The resulting conditions of atrial fibrillation are life-threatening, otherwise, it itself is not fatal. In a normal person, the upper part of the heart, atria, beats parallel to the lower chamber of the heart, ventricles. On the other hand, in atrial fibrillation, the beats of the atria and the ventricles are not simultaneous. The unmatching beats of the two portions of the heart are known as atrial fibrillation. It may not have symptoms in many patients, however, palpitations, fast and pounding heartbeat, and short breaths are very primary symptoms a patient may experience. Atrial fibrillation may occur in continual episodes, as well as may continue with persistence. As it may result in blood clots and heart failure, that is why it may be taken seriously. It must be treated timely, so that the time factor may not aggravate the condition. Symptoms of atrial fibrillation. There are several symptoms of A-Fib, which some people even don't feel at all. However, more than half of the patients feel these symptoms. The very first and most common symptom of A-Fib is that the patient feels a very fast, jerky, and pounding heartbeat. The pounding and fluttering heartbeat is also known as palpitation. Extreme fatigue is another sign of A-Fib. Dizziness and lightheadedness are also experienced by the patient. Fainting or syncope is also experienced by the patients. Fainting is a type of disorder in which you lose consciousness for a short time. It's caused by a sudden drop in blood flow to the brain. A fainting episode usually lasts a few seconds or minutes, then the person wakes up and returns to normal. The rapid heartbeat causes shortness of breath. The patient usually takes short breaths, like they are extremely tired. The shortness of breath is also known as dyspnea. Due to irregular heartbeat and blood flow, the patient goes through chest pain, which, in the medical field, is known as angina. A perpetual weakness and tiredness prevail all the time, which reduces the ability to do exercise and physical work. Causes of atrial fibrillation. The unusual heart structure is the main cause of atrial fibrillation. Other than the heart structure, some causes may be as follow: coronary artery disease. Coronary artery disease, CAD, is a narrowing or blockage of your coronary arteries, usually due to plaque buildup. Heart attack, medically known as a myocardial infarction. A heart attack means the blockage of the vessels, which transport blood and oxygen to the heart. The heart muscles die because of the lack of blood supply. Defective heart, a congenital heart defect. High blood pressure. High blood pressure is a common condition that affects the body's arteries. It's also called hypertension. If you have high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The heart has to work harder to pump blood. Lung diseases. Diseases associated with the lungs also cause atrial fibrillation. Physical stress due to surgery, pneumonia, or other illnesses may be a cause of atrial fibrillation. Heart surgery. Previous heart surgeries may cause A-Fib. Sick sinus syndrome. Problems with the heart's natural pacemaker, sick sinus syndrome, may also cause A-Fib. Thyroid diseases. An overactive thyroid, hyperthyroidism, and other metabolic imbalances affect heart rhythm. Use of stimulants. Stimulants, including certain medications, caffeine, tobacco, and alcohol, cause heartbeat problems. Sleep apnea. It also causes A-Fib. Sleep apnea is a serious sleep disorder, in which breathing repeatedly stops and starts consecutively. Viral infections. Some viral infections, especially influenza viruses, affect the heartbeat and cause atrial fibrillation. Heart valve problems. A heart valve may have a stenosis or narrowed valve, which does not allow a sufficient quantity of blood to or from the heart. A heart valve may have a loose or leaking valve, in which the valve flaps don't close properly, causing blood to leak backward in your heart. This commonly occurs due to valve flaps bulging back, a condition called prolapse. In some cases, There is a solid sheet of tissues rather than valves, which blocks the flow of blood between the heart chambers. Types of atrial fibrillation. Atrial fibrillation may be of the following types. Paroxysmal atrial fibrillation. It is an occasional A-Fib that has symptoms that come and go. These symptoms usually last for a few minutes to hours. Sometimes they last for a couple of days and weeks, with repeated episodes. Most people with paroxysmal A-Fib may not need treatment, as it fades away on its own. But in the case of long-lasting paroxysmal A-Fib, treatment is needed. Persistent atrial fibrillation. As the indicates, it lasts for a longer period of time, and the heartbeat does not go back to normal on its own. If a person has A-Fib symptoms, cardioversion or treatment with medications may be used to restore and maintain a normal heart rhythm. Long-standing persistent A-Fib. If the persistence of the condition lasts as long as 12 months, it is known as long-standing persistent A-Fib. It needs serious care and treatment. Permanent atrial fibrillation. It is not a restorable condition. The patient needs exclusive treatment to avoid blood clots. Risk factors of atrial fibrillation. Age factor. Advancing age increases the risk of atrial fibrillation. People older than 65 have higher chances of A-Fib. It is uncommon in boys and children, however, those who are suffering from obesity may have the risk. High blood pressure. Patients with high blood pressure are vulnerable to A-Fib. Having high blood pressure, especially if it's not well controlled with lifestyle changes or medications, can increase the risk of atrial fibrillation. Thyroid disease. In some people, thyroid problems may trigger heart rhythm problems, arrhythmias, including atrial fibrillation. Hereditary and family history. Scientists have found some genes with mutation, which transfer the risk of A-Fib to the descendants. Racial factor. Some races are more vulnerable than others. In the United States, A-Fib is very common in white Americans than those who belong to the black race. Social habits. Social habits like excessive use of drugs, alcohol, smoking, and even secondhand smoking exposure may increase the risk of A-Fib. The longer you use the narcotics, the risk appears to be higher. Consumption in large amounts, especially binge drinking, raises your risk of atrial fibrillation. Even modest amounts of alcohol can trigger atrial fibrillation in some people. Inadequate physical activities. Inadequate physical activities like participating in endurance sports or physically working hard may lead to a higher risk of atrial fibrillation for some people, especially competitive athletes and men. At the same time, moderate physical activity can have a protective effect. Physical fitness appears to be linked to a lower risk of atrial fibrillation. Mental conditions. Stressful situations, panic disorders, and other types of emotional complications may be linked to a higher risk of A-Fib. Chronic health conditions. Scientists associate many other health conditions and disorders with the risk of atrial fibrillation. Advancing age along with one or more of the following health conditions may increase your risk: chronic kidney disease, conduction disorders, congenital heart defects, coronary heart disease, diabetes, heart attack, heart failure, heart inflammation, heart tissue that is too thick or stiff, heart valve diseases, high blood pressure, hyperthyroidism and overactive thyroid gland, lung diseases including COPD, obesity, sarcoidosis, sleep apnea, obesity/overweight. People with obesity have a higher risk to suffer from A-Fib. Before going through the relationship between obesity and A-Fib, we need to understand what obesity actually is. If your BMI, body mass index, is 18.5 to less than 25, it falls within the healthy weight range. But if it is 25.0 to less than 30, it falls within the overweight range. If your BMI is 30.0 or higher, it falls within the obesity range. Regarding heart rhythm disorders, obesity is associated with an increase in atrial fibrillation, AF, the most common arrhythmia in clinical practice. AF is associated with increased cardiovascular morbidity and mortality. Obesity, a novel risk factor, is responsible for a 50% increased incidence of atrial fibrillation. Surgery. Recent heart, lungs, and esophagus may put you at risk of A-Fib. It is because of muscular tension caused by surgery. Thyroid diseases. In some people, thyroid problems may trigger heart rhythm problems, arrhythmias, which may lead to atrial fibrillation. Complications of atrial fibrillation. Afibrillation itself is not a fatal condition. However, it can lead to severe conditions, which may cause serious health complications and even death. Following are the complications associated with A-Fib. A-Fib and stroke, A-Fib and cardiomyopathy. Heart attack and heart failure. Dementia/memory loss. High blood pressure. Some valvular heart disease.